Hello, my name is Julie Dagum and I am a pharmacist, and I would like to give you a little bit of information on epilepsy drug therapy. What I'd like to do is really just focus on the medications that are used to treat epilepsy. Just to give you an overview of the information we will be talking about today, first I'll go over some general information about treating seizures with medications. Then we'll talk about some general points that apply to all anti-seizure medications. We'll talk more specifically about the most common medications used to treat seizures, and I'll end by sharing some key reminders. Medications don't cure epilepsy, but they can suppress or control seizures and prevent the damage that seizures can have on people both physically and emotionally. There are other options for treatment besides medications, but today we'll focus specifically on the medications. The goals of drug therapy is to prevent seizures from occurring while avoiding side effects from the medications. In order to do this, it's very important to be aware and to talk with physicians and patients about side effects so that you can work together. One thing to consider is that it may take time for the medications to work, so we have to stick with a particular regimen and give it a chance to work. There are several factors that affect this. Number one, it takes time for the medication to be absorbed from the stomach and enter the blood. Number two, as soon as the medication is in the bloodstream, the body works to metabolize and eliminate the medication. And number three, as a result, drugs are more effective when they're at steady state or equilibrium. Basically, the intake of the drug equals that of the elimination of the drug. Some drugs remain longer in the body due to either their formulation or due to just the nature of the drug itself. Some drugs need to start at lower doses and slowly increase up to reach a level where seizures are controlled and side effects are tolerated, so this may take longer for the medications to start working to control seizures, but the side effects may be less likely to be a limitation. As a general rule, not all medications are a good choice in all patients. There are several key points to consider in selecting the best medication. Efficacy, depending on the seizure type, in the medication that's selected should work for the type of seizure being treated. Safety, in that consider the effect the medication has on the organs, long-term effects, and if the drug is a good choice based on other disease states the patient has. Drug interactions, if the drug will be a good choice based on other medications the patient is taking. Side effects, essentially tolerability, we would like to avoid a situation where side effects cause the patient to stop the medication, and although some side effects are common to all anti-seizure medications, some are specific to a particular medication. And finally, patient management and monitoring. Some medications require closer follow-up than others, and we need to be sure this is something that the patient is able to do if the medication is selected. In some cases, blood tests are required before starting a medication. For example, we may need to check baseline electrolytes, liver functions, and kidney functions to determine if a certain medication is a safe choice for that person. After medication therapy is started, in some cases we will need to draw more blood periodically to check the level of medication that's in the blood. The reason for this is to compare the amount of medication that's in the blood to the usual therapeutic range, which is the range where the blood level is high enough for most patients to have good seizure control, but low enough for most patients to have few or minimal side effects. Although the dose that the patient will need of a certain medication can be unpredictable, the consideration on both the dose and the blood level can vary. The dose of the anti-seizure medication that produces a certain blood level for one patient can be different from the dose that another patient would need, and blood levels may also vary. Some people may need higher or lower levels for seizure control, so the therapeutic range is not an absolute rule, but rather a starting target. The importance of levels, then, is to help guide a starting dose and adjust the medication from there. They may help explain unusual doses, and they can be used to check compliance. The timing of these levels depends on the medication used, whether side effects or seizures are occurring, and convenience. Also, sometimes there are no established therapeutic levels, so levels are not checked as frequently as others. In addition, sometimes switching between different medications or other things like tobacco, alcohol, or drug interactions or forgetting doses can also affect the levels. Until 1993, the more traditional medications, including phenobarbital, phenytoin, primidone, ethosuximide, carbamazepine, and valproic acid, and they were known as the traditional agents. Since then, several new drugs are available. This means that the possibility of using combination therapy with 2 or more anti-seizure medications is a real possibility. There are a few cautions with this. For example, the blood level of the medications may be affected if the medications interact with each other. Also, the side effects from each medication may be similar and may be additive. There is the potential of using the newer medications all by themselves, even though most of the new agents were studied in combination with the traditional medications. Many of the medications can also be used for more instances than just to control seizures. Some of these uses include nerve pain, headaches, to enhance or stabilize mood, to help sleep, and many other uses. It is important for patients to know why they're taking these medications, because in some cases the correct dose can be very different depending on the use. In addition, a lot of the information that the patient might receive at a pharmacy, like pharmacy printouts, will not be very specific to the different uses of the medications. So the most important thing is that the patients know their medications, including the name and strength, what they look like, and the dose. And for healthcare practitioners, it's important to really question patients and get a very accurate list of what patients are taking. Although all of the anti-seizure medications have the potential to interact with other medications, some medications are much more notorious than others. It is even more complicated because sometimes it's difficult to predict if an interaction will occur or exactly what that interaction will be. It is common for other medications to affect blood levels of anti-seizure medications, so many times blood levels will need to be checked when other medications are added or removed from a regimen. In addition, many over-the-counter medications and herbal products can interact with anti-seizure medications. Sometimes side effects can be similar by having 2 medications that cause the same side effect. Then the side effect is worsened. For example, taking Benadryl with an anti-seizure medication can cause increased drowsiness, because both of them independently can cause drowsiness. Because drug interactions are so common, many affect blood levels or seizure control, and extra steps may be needed to manage the side effects. So we really need to make sure that we know all of the medications that the patients are taking, including over-the-counter medications and herbal medications and products. It's also a very good idea to encourage patients to go to one pharmacy or to make sure that the pharmacist knows all of their prescription medications, over-the-counter medications, and herbal products. A big part of the pharmacist's job is to screen for interactions that may have been missed or suggest ways to manage side effects and interactions. So overall, we want to make sure that patients really know their medications and that we really know what our patients are taking. A few general comments about some side effects of the anti-medications. And first and foremost, there's a lot of information regarding the side effects that have been reported in the literature and from what patients have reported. Side effects are very patient-specific and unpredictable. Not everyone experiences side effects, and if a person has a side effect from one medication, that does not mean that they will have a side effect from a different medication. Many side effects can be minimized by starting with a low dose and increasing it slowly. Some side effects are not life-threatening and may go away with time. Other side effects are more serious and may require discontinuation of the medication. Certain side effects are associated with a particular medication only, and other side effects apply to the entire group of anti-seizure medications. The side effects of drowsiness, dizziness, unsteadiness, clumsiness are common to all anti-seizure medications. We will talk about specific side effects of specific medications when we talk about each agent later. Although all of the anti-seizure medications have the potential to cause drowsiness, dizziness, unsteadiness, and clumsiness, these side effects may be minimized by starting with a low dose and increasing it slowly. Tolerance to these side effects will develop over several weeks. If it is intolerable after several weeks, a different medication may be tried. There are some important considerations with these side effects that again are common to all anti-seizure medications, such as careful when driving or operating machinery, and careful with other medications, both prescription and over-the-counter, that may cause drowsiness, such as antihistamines, cough and cold products, pain medications, and other anti-seizure medicines. If patients notice a rash, which can happen with nearly all the anti-seizure medications, it always needs to be reported. It may be mild, but it could also be aggressive and progress into something called Stevens-Johnson syndrome, which is a rare but serious dermatological condition that can be fatal. Bone loss from certain anti-epileptic drugs may be more common than generally appreciated. It is a good idea to consider having your patients take a calcium or vitamin D supplement under the direction of you, and especially if they're taking certain types of medications. To continue with general information that applies to all anti-seizure medications, there may be times when a dose is missed or forgotten. In general, patients should take the missed dose as soon as they realize it, unless it is time for them to take their next dose. If that's the case, then they should just skip the missed dose and just take their scheduled dose. Overall, making up for a missed dose of an anti-seizure medication may be a little more complicated when compared with other medications, but that's because many of the anti-seizure medications are touchy and the dose is individualized to the patient. In addition, it's very important to be aware that any time an anti-seizure medication is going to be stopped, it should be done so gradually rather than stopping the medication abruptly, because stopping the medication abruptly could actually cause seizures. As with all medications, they should be stored appropriately and kept out of the bathroom and kitchen because of moisture and humidity, and they should be kept away from children. On your slide is listed the Poison Information Center for the Milwaukee area. Phenytoin, valproate, carbamazepine, as well as other medications are the traditional agents that have been used for years to treat seizures. There are many limitations to the usefulness of these agents, such as side effects and monitoring requirements. As a result of these shortcomings, many newer agents have been developed within the past decade, and we will talk about the newer agents in the next slide. The newer agents are designed to have advantages over the traditional agents. Typically, they have a novel way that they work to reduce seizures, have fewer side effects and are better tolerated, have fewer drug interactions, and require less frequent blood level monitoring than the traditional agents. Despite the newer medications that are available, the ideal medication still does not exist. The newer medications that we'll talk about include oxcarbazepine, which is trileptal, lamotrigine, which is Lamictal, levetiracetam, which is Keppra, gabapentin, which is Neurontin, pregabalin, which is Lyrica, topiramate, which is Topamax, tiagabine, which is Gabitril, and zonisamide, which is Zonegran. There are others that exist, but these are the most common. Another advantage of the newer agents is that the drug levels are not as well established, so intensive blood level monitoring is not typically necessary. A baseline blood level may be checked, or if unexplained seizures occur. In some cases, the level might need to be sent out somewhere, so it may take longer to get the results, and a drug level may be used to check compliance. Now that we've discussed the principles and goals for medication therapy as well as some general information that applies to all the anti-seizure medications, we'll go over some of the most common anti-seizure medications and information that applies to each medication specifically. For each medication, we'll go over use. I'm not going to cover costs simply because cost information is always an approximation, and cost information may not be accurate as the cost of medications can change daily. There are so many things that affect costs as well, including the dose, the number of tablets prescribed, patient's insurance plans, and the particular pharmacy. So it is always best to check with the pharmacist for the most up-to-date cost information. We will cover usual dosing and therapeutic levels, side effects, drug interactions, and any miscellaneous information specific to the medication, if applicable. Phenytoin is a medication that is used for all different types of seizures, status epilepticus, tonic-clonic seizures, and complex partial seizures. It's also used for nerve pain conditions. It's an older medication, and its use has largely been replaced by other medications because of touchiness of dose adjustments, side effects, and drug interactions. However, there are still a lot of people on phenytoin, and a lot of times it's used as first-line therapy. One advantage is that phenytoin is one of the few medications that is available as an IV formulation, which makes it useful when patients are in the hospital and are unable to take medications by mouth. There are a lot of complications and risks to IV therapy, however. It also has many oral formulations available in both brand and generic products. So we want patients to be very careful that they receive the same medication. There are several different dosage forms, and the usual dosing range is somewhere in the neighborhood of 300 to 400 milligrams daily. However, this can vary greatly depending on the patient. The blood level that we're shooting for is typically between 10 and 20 micrograms per milliliter. Usually this blood level is sufficient, but there are sometimes blood levels that might be used in different situations. We can also draw a free level, which measures the plain drug that is not attached to blood proteins. That level, usual therapeutic range, is 1 to 2 micrograms per ml. Side effects for phenytoin and fosphenytoin are typically one of the reasons why this medication is not as popular of a choice anymore. Some of the possibilities of side effects besides the dizziness, drowsiness, unsteadiness, and clumsiness possible with all anti-seizure medications include nausea, vomiting, constipation, appetite changes. It may cause hair growth, and it may cause gum overgrowth, so it's important for patients to have good dental follow-up. It may also cause kidney problems, so patients may need to have blood work done to make sure that this doesn't occur. Some of the serious side effects that can occur might be fever, sore throat, which could be signs of leukopenia, bleeding and bruising, which could be signs of liver problems, hives, blisters, or a rash. And that could be signs of Stevens-Johnson's or a lupus-like syndrome. There are many drug interactions associated with phenytoin. Phenytoin binds to blood proteins, so this causes a lot of the drug interactions with other medications that bind to blood proteins as well. Some of the common drug interactions are listed on the slide, but these are only a few examples and may not happen to everyone. Also, the literature varies so much regarding drug interactions, so many more could occur. The ideal management of drug interactions depends on seizure control, severity of interactions, and many other factors, but checking blood levels is one way to monitor this. A couple of miscellaneous things associated with phenytoin is that for sure the prescriber should know the medical history, because phenytoin can make conditions such as kidney problems, liver problems, and blood problems worse. In addition, the intravenous form of phenytoin, known as fosphenytoin, is called Cerebrix, and that can sound much like Celebrex, which is an arthritis and pain medication. In addition, levels can be affected by so many different things, including nutritional status, alcohol intake, tube feedings, and change in brand. Alcohol can increase the chance of seizures and sedation because phenytoin is metabolized faster, and increased doses might be needed. In addition, phenytoin could be taken with food if stomach upset occurs, and the capsule coating could be excreted in the stool. And if this happens, there's nothing wrong. It's just that the medication is embedded in the dosing form, as opposed to the coating being found in the stool. Valproate or valproic acid, which is known as Depakote or Depakine, is the next medication. And they are very similar, and both are essentially valproic acid, but they have slightly different chemical structures. This medication, or group of medications, is used to treat seizures, for migraine prevention, for bipolar mania, and for other situations such as ringing in the ears. There are many different dosage forms which are listed on the slide, and essentially the take-home message here is that patients need to be very careful to know what formulation they are taking, and prescribers need to be very careful to know what formulation the patients are taking so that the same formulation can be used consistently. In addition, there is an IV version known as Depakine, and again, valproate then is another one of the medications with the limited number of IV forms that are available. The usual dosing range for valproate is 10 to 15 milligrams per kilogram per day, divided 1 to 3 times per day. Levels that we shoot for are typically between 50 and 100 micrograms per ml, although higher levels can be accepted. Weight gain, in addition to general side effects, is one of the significant side effects, Also, nausea, diarrhea, abdominal cramping can occur. If this occurs, patients can take it with food if stomach upset occurs. Also, some other side effects that may occur with this medication might be menstrual cycle changes for females, trembling, hair loss, which is usually temporary but can be significant, confusion, headache, low platelets, rash, which can be serious, and liver failure, pancreatitis, which can be serious. So the major things to watch out for would be liver failure, pancreatitis, low platelets, and the things that tend to bother patients are weight gain, diarrhea, abdominal cramps, and hair loss. Some of the most common drug interactions with valproate are listed on the slide, and in many cases, the drug interactions affect the blood levels of valproate or the anti-seizure medication if combination therapy is needed. Again, some examples are listed on the slide, and these are only a few of the many examples, so checking blood levels is another way to monitor these side effects. A couple of miscellaneous things specific to this medication is that if it's an extended release tablet, they should not be crushed, they should be swallowed whole. And delayed release tablets are coated and they can be split but not crushed. They are available in a sprinkle capsule which can be opened and added to food, and we need to definitely make sure that patients don't have liver dysfunction, particularly during the first 6 months of treatment. Finally, the tablet coating may be excreted in the stool, and again, that's not something to worry about, but just something to warn patients if they are concerned. Moving on to carbamazepine, or also known as Tegretol, Carbatrol, and other names. This medication is used for seizures, but it also could be used for nerve pain syndromes and bipolar disorder. The dosage forms are listed on the slide, and there are some generics available. The usual dosing range for carbamazepine is typically between 100 and 200 milligrams twice a day, although again, this dose can vary. The dose is increased very slowly, and it's usually increased to decrease side effects. It's usually increased very slowly to decrease side effects. The typical maintenance dose can be quite a bit higher, 400 to 1200 milligrams a day, and it's usually divided 2 to 4 times daily. The blood levels that we're shooting for this medication run between 4 and 12, although some patients can run slightly higher than 12. Some of the side effects associated with carbamazepine include vision changes, sedation and tiredness, nausea or vomiting, low blood factors including platelets and white blood cell counts, rash, which could be rare but serious, and sun sensitivity. Some of the major side effects to watch out for would be sedation and tiredness. For some reason, this medication tends to cause more sedation and tiredness than some of the other anti-seizure medications, so that can be significant. The other thing to watch out for are the low blood factors, in particular the white blood cell counts, as this medication can cause aplastic anemia. Carbamazepine is another medication that has many drug interactions, and again, these are only a few examples. Again, checking blood levels of carbamazepine and the interacting medication is one way to monitor these side effects. Carbamazepine can also affect liver enzymes and can change the metabolism of other medications, so carbamazepine itself might have effects on other medications. Another interesting interaction is that grapefruit juice can affect carbamazepine levels. Grapefruit juice inhibits enzymes that metabolize carbamazepine, so doses may need to be adjusted and blood levels checked. The best way to prevent this interaction is to avoid grapefruit juice. A couple of miscellaneous things specific to this class of medications is that carbamazepine is structurally similar to the antidepressant imipramine. This means that if patients are sensitive or have an allergy to the class of medications that include imipramine, which is known as the TCA medications, they also may be sensitive or have an allergy to carbamazepine. In addition, again, if the coating of the medication is found in the stool, that can be normal, and Carbatrol is a dosage form that's a capsule that may be opened and sprinkled on food. Trileptal, or oxcarbazepine, is a medication that is real similar to carbamazepine. It's a derivative of carbamazepine that we just talked about. The difference is that trileptal may be a little bit better tolerated and may require less blood level monitoring. It is typically taken twice a day, and it does have a pretty wide dosage range. There are several notable side effects that can happen during therapy with trileptal. Double vision or changes in vision were among the adverse effects most frequently associated with discontinuation of trileptal in clinical trials. Rash can also occur with trileptal, but it is less common than with carbamazepine. The rash can still be serious though, so it needs to be reported. Like with carbamazepine, trileptal can affect electrolytes, especially sodium. In addition, patients that have kidney problems should have their electrolytes checked before starting trileptal and then again within a few weeks after starting the medication. The electrolyte that is typically out of balance with trileptal, as with carbamazepine, is sodium, and typically this is hyponatremia. In many cases, patients are asymptomatic, however, it's something that should be monitored. Although trileptal has some known drug interactions, there are fewer drug interactions associated with trileptal as compared with carbamazepine. There are a couple that are listed on the slide for you. So overall, trileptal may be better tolerated than carbamazepine. However, you should be aware that if your patient has had an allergic reaction to carbamazepine, then they have an increased chance of being allergic to trileptal as well. In general, if somebody needs to discontinue the carbamazepine because they are being oversedated on it, but they had very good seizure control, then perhaps trileptal is a good medication to try. However, if somebody needed to discontinue their carbamazepine due to more a serious allergic reaction or a skin rash, then that might not be something that you would want to re-challenge with trileptal. The next medication is lamotrigine, or Lamictal. It's very commonly used for seizures, but it also has been used for nerve pain, for migraine headaches, and for mood elevation. It is available in various strength tablets and as a chewable tablet. Just as a general note, however, the medication is generally more expensive than other options at this point. Some of the chewable tablet forms are available generically, however, they typically are not significantly cheaper than the brand. Lamotrigine is initially started at a very low dose of 50 milligrams once a day, or even a smaller dose depending on if drug interactions are occurring. The dose is slowly increased every 2 weeks until a dose of 100 milligrams twice daily is reached. Although it may take up to 2 months to reach the target daily dose, the slow increase is very important to follow closely in order to avoid side effects including rash. Blood levels are usually not done frequently because the levels are not well established. Therefore, levels are typically done to check therapy or if a seizure occurs. Of note, Lamictal sounds very similar to other different medications, such as Lamisil, which is used for fungal infections, Lamivudine, which is used for HIV, or Lamotil, which is used for diarrhea. There have been several reports of this medication being mixed up with the other medication, and there have been medication errors that have occurred, so pay particular attention to this risk. As we talked about, the most common side effect seen with lamotrigine is a rash, which can be serious or even fatal. A slow dose increase helps to reduce the incidence of rash. However, if it does occur, patients need to contact a healthcare professional as soon as possible, as it could be very serious. The rash is also more likely to develop if the combination of valproate, which is Depakote, and Lamictal is used. It is also more common in children younger than the age of 16 years old. Aside from the rash, lamotrigine can also cause side effects including headache, nausea, and blurred vision or double vision. Typically, it's very well tolerated, however, and side effects are usually minimal if they occur. Another advantage with this medication is that it may be less sedating than other seizure medications. As I mentioned, there are just a few drug interactions associated with lamotrigine, but one of the major drug interactions includes the interaction with valproic acid. Most of the other interactions are that the anti-seizure medication can alter the blood level of the lamotrigine. This can mean that the dose of lamotrigine may need to be slightly higher or lower if the patient is taking one of the other medications to counteract that drug interaction. Keppra is another very commonly used medication. It was approved for use in the United States in 1999 and can be used for many different seizure subtypes as well as for combination therapy for seizures. Keppra is available as a tablet, but it's also available as an oral solution and an intravenous solution. It is typically dosed twice a day. The dose is usually started at the lower end and can be increased about every couple of weeks to a maximum dose of 3,000 milligrams per day. Keppra is eliminated completely by the kidneys, so doses may need to be lower if your patient has kidney problems. If side effects with Keppra are going to occur, in many cases that side effect might be behavioral changes such as fluctuating emotions, mood swings, aggressiveness, and anxiety. This is something to pay attention to or ask patients to have their family members watch for it and report it if it occurs. Other side effects may include headache, but overall Keppra is generally very well tolerated. Keppra also is advantageous in that there are very few drug interactions associated with it. A few other miscellaneous things with Keppra is that it is, again, almost completely renally eliminated. The oral dose is nearly 100% bioavailable, so the IV dose equals the oral dose. And from a drug safety standpoint, this medication has been involved with medication errors with the HIV drug Kaletra. Neurontin or gabapentin was approved in 1994 for seizures. It is an effective medication, but the majority of use of Neurontin is actually for nerve pain. Typically, we see it being used to treat seizures in combination with other medications for several different seizure subtypes. Exactly how Neurontin works is not exactly understood. It is available in various strengths, and the lower strengths are typically capsules while the higher strengths are tablets. It is also available as a suspension, but the taste is very unpleasant, so it's typically not used very often. Neurontin is generally very well tolerated and has not been associated with many significant adverse effects. Sometimes people have reported weight gain, eye movement or vision changes, tremor, or numbness in their extremities. In many cases, the side effects improve over several weeks. Neurontin also has a very, very wide range, so the dosing can be very different. In many cases, too, if the dose is used for pain, then the dose can be pushed much higher than what we might see for a seizure disorder. One of the disadvantages with Neurontin is that it is typically dosed 3 times a day for seizures, and we typically start low and gradually increase the dose to decrease the potential for side effects. Gabapentin is also advantageous in that it has a typically pretty clean drug interaction profile. It usually does not interfere with some of the other medications that we typically see interfering with the group of anti-seizure medications as a class. The dose may need to be adjusted slightly for kidney dysfunction because it has almost complete renal elimination. However, this medication does have little effect on other anti-seizure medications, on the liver, or on blood, and many of the other medications do affect various blood factors such as platelets or white blood cell counts. Pregabalin or Lyrica is another medication, and it actually was recently approved for seizures. It can be used for seizures for neuropathic pain such as diabetic neuropathy or postherpetic neuralgia. It also can be used for anxiety, social phobia, or other pain conditions. It comes in a variety of dosage forms, and the usual dosage range entails increasing slowly to avoid adverse side effects. The typical range for seizures is up to about 600 milligrams a day, usually divided twice or 3 times a day. For neuropathic pain, the doses we typically see are up to about 300 milligrams a day. However, for postherpetic neuralgia, we usually see up to about 600 milligrams a day. Some of the side effects related with the use of pregabalin or Lyrica is drowsiness or dizziness. This is another one of the medications that is a little bit more so causing drowsiness and dizziness than some of the other medications. Sometimes we also see weakness, uncoordinated movement, tremor, difficulty with concentration and attention, headache, blurred vision, weight gain, and dry mouth. From the standpoint of drug interactions, there typically are not a lot of drug interactions unless they are additive side effects in terms of drowsiness or cognitive and motor function with other medications that affect the central nervous system. Another interesting point with this medication is that it is a Schedule 5 controlled medication that is almost completely renally eliminated, so the dose does need to be adjusted if somebody has kidney dysfunction. The reason why the medication is a Schedule 5 controlled substance is that in a study of recreational users of sedative hypnotic drugs, including alcohol, Lyrica received subjective ratings of a good drug effect, high, and liking to a degree that was similar to diazepam. In controlled studies, Lyrica-treated patients overall reported more euphoria as an adverse effect than compared to their placebo counterparts. Though in some of the patient populations studied, this reporting rate was actually much higher than others. Overall, this led the FDA to determine that this should be a Schedule 5 controlled substance because there was suggestion of physical dependence with this medication. Topamax or topiramate was approved in 1997. It is used for seizures in adults and children and also for migraine headache prophylaxis. It is used for many types of seizures, including childhood epilepsy disorders and generalized tonic-clonic seizures in children and adults, as well as for add-on therapy. Side effects sometimes limit the popularity of this medication, but it is very effective, especially in children. Topiramate's anti-seizure effects are believed to arise from several different mechanisms. It is available in a tablet form as well as a sprinkle capsule. Topiramate is started at a low dose, it might be 25 or 50 milligrams at bedtime, and titrated up very slowly every 1 to 2 weeks to the usual dose of up to 200 milligrams twice a day. The slow increase may decrease cognitive side effects such as confusion, dizziness, drowsiness, and speech and word-finding difficulties. Close monitoring of blood levels of topiramate is usually not necessary to optimize therapy, but may be used as a reference point once the patient is stable. The main side effects associated with topiramate are listed on this slide, but the common or bothersome side effects are hesitance with speech and tingling in fingertips and toes. Also, adverse behavioral effects have been reported in some children taking the drug. Overall, these side effects occur early in therapy if they are going to occur, and they usually resolve and may be minimized by the slow titration. A favorable side effect for many people is that topiramate can cause a decrease in appetite, which can result in the possibility of weight loss. Topiramate is a better choice than other medications in liver disease because it's not extensively metabolized. Blood, liver, and other lab monitoring parameters for Topamax are typically not necessary. Topamax does carry a risk of kidney stones, but they usually pass spontaneously. It is important to drink lots of fluid and to avoid interacting medications to reduce the chance of kidney stones. From a drug interaction standpoint, there are several things to be concerned about with Topamax. Many of the major ones are listed on this slide for you. Other than these, there are very few significant drug interactions with topiramate. Levels of just a few drugs may be altered slightly, but this can be easily monitored. Topiramate can be taken without regard to food, although food may minimize the side effects. The tablets should also be swallowed whole because they taste bitter, but the sprinkle capsules can be opened and sprinkled on soft food, which is really helpful, particularly if you're dosing for children. Just to briefly mention tiagabine, it was approved in 1997 to be used as combination therapy for refractory partial seizures, but also is effective as monotherapy for partial seizures and as add-on for secondary generalized seizures, and may be effective in children. It really is an agent that is not typically used first line for either seizures or for nerve pain. It is available in a tablet form only. Tiagabine is also started at a low dose of 4 mg per day and increased at weekly intervals up to a dose of anywhere between 32 and 56 mg a day, divided by 2 to 4 times daily. Blood levels are not well defined, and so they are not monitored often. The most common side effects include dizziness, depression, weight gain, and anxiety, and for these reasons, the medication is typically reserved for when other medications fail to control seizures. Tiagabine does not appear to alter blood levels of other anti-seizure medications. However, other anti-seizure medications may affect tiagabine. The dose of tiagabine may need to be adjusted slightly to account for this. As an advantage, tiagabine does not appear to decrease the effectiveness of birth control pills, although caution is always warranted. Tiagabine should be taken with food to enhance absorption and effectiveness, and also to decrease side effects. In addition, there are some warnings with tiagabine in that it has been reported to cause seizures in people who do not have a pre-existing seizure disorder. This is an interesting phenomenon as it's an anti-seizure medication. However, it may actually cause seizures. The last medication to discuss is Zonegran or zonisamide. It has been available in Japan for years, but was first made available in the United States in the year 2000. Zonisamide is used to treat partial and complex seizures and those resistant to other therapy, so it has a wide application of use. It also can be used for nerve pain. It is available as a 100 mg capsule and a 25 mg capsule, and it started at typically 100 mg once a day at bedtime. The dose may be slowly increased to a maximum of 600 mg per day divided in 1 or 2 doses. Blood level monitoring is not typically necessary but may be checked occasionally during therapy. It takes about 2 weeks after each dose adjustment to reach a steady blood level. Zonisamide has a relatively clean side effect profile. Most side effects are mild, and the zonisamide is generally well tolerated. Side effects may be reduced by decreasing the dose. To highlight some of the more serious side effects, there have been reports of behavioral problems in children, as well as agitation and irritability. Other serious reactions include anemia, leukopenia, and rash and skin eruptions that could progress into the potentially fatal Stevens-Johnson syndrome. If a rash is going to occur, it usually occurs within the first 4 months of treatment. Like with topiramate, kidney stones can occur. It is encouraged to drink lots of fluids and avoid other carbonic anhydrase inhibitors. When Zonegran was developed in Japan, there were cases of inability to sweat resulting in overheating. So far, this has not been something that's been reported in the United States, but something to be aware of, and this could be very serious. Be especially cautious of fever or increased body temperature in children. Finally, Zonegran can affect appetite, so there can be an incidence of weight loss with this medication. Zonisamide has few drug interactions with other drugs overall. In general, other drugs will affect zonisamide levels, which is less significant because Zonegran's therapeutic range is very wide. It is very important to realize that zonisamide is a sulfa drug, so if patients are allergic to sulfa, they may have a cross-sensitivity to this medication as well. This medication should also be avoided if there are pre-existing kidney problems because of the kidney stones or because it can contribute to pre-existing renal failure. I've included this slide with several helpful websites that you may find either to recommend to patients or to use yourself in terms of finding more information about epilepsy and epilepsy medications. We've covered a lot of information on quite a number of medications. Remember that this information is general and each person is very different in the way they react to medications. There can be very different profiles in terms of the success of a medication that a certain person has from a combination of medications or a specific medication. There can also be significant differences between side effects that they may or may not experience, and that a medication regimen is very personal and should take into account all of these factors. It is very important for the patient to take an active role in their medications. Some of the things that may be important to tell patients when treating them with these medications would be to take responsibility for their health care by following up with their appointments, by knowing their seizure subtype, by being aware of their medications, including the name, the dose, the appearance of the medicine, the frequency, and the number of refills they have, to take their medication as prescribed and be honest with their healthcare provider regarding missed doses or their ability to take the prescribed regimen. And this can affect decisions that are made so that there are many options available and can be tried if one regimen does not seem to work. We would also ask patients to pay attention to how they feel so they can report it to their healthcare provider. And finally, we encourage patients to ask questions so that they can get answers and explanations so that they can understand their medications and their medical plan. That concludes this presentation. I hope that you found it to be very helpful. Thank you.